Hello, we are third-year pharmacy students from UCSF, and we are pleased to present our research findings regarding postoperative ileus, or POI, in older adults undergoing elective surgery at UCSF Medical Center. As we know, opioids encompass a class of drugs routinely administered for postoperative pain management in inpatient surgical settings. With the elderly population undergoing surgery at a higher rate than their younger counterparts, post-op opioid management, especially as it relates to adverse events, becomes of chief concern among this demographic. One serious complication related to opioid medication use is POI. Ileus that extends beyond 3 days postoperatively may result in further complications such as poor wound healing, ischemia, and in serious cases, perforation. In addition, prolonged POI has been associated with increased hospital length of stay, increased rates of 30-day hospital readmission, and excess hospital costs.
Our study was a retrospective cohort study using UCSF electronic medical record system data to determine the incidence of POI in non-cancer surgical patients 65 years and older. Secondary endpoints included time to ambulation, hospital length of stay, and total oral morphine equivalents, or OMEs, given during inpatient stay. The study population included opioid-naive non-cancer patients age 65 and older who underwent general, neurological, or orthopedic surgery under general anesthesia and who were discharged home after hospital stay. Incidence of POI was ascertained using ICD-10 codes, radiologic imaging such as KUB, CT, or X-ray scans consistent with POI, as well as patient discharge summary. Patient ambulation data were derived from the UCSF 10-point Likert mobility scale and provider notes. Study covariates included length and type of surgical procedure, postoperative OME administration, hospital length of stay, and patient's postoperative disposition, all of which were ascertained from the study subject's EMR. All analyses were performed using R.
In the period January 1st, 2017 through December 31st, 2019, 538 adult surgical patients met inclusion criteria, including 164, 169, and 205 unique patients in 2017, 2018, and 2019 respectively. 284 patients underwent neurological surgery, followed by 143 patients who underwent general surgery, and 111 patients who underwent orthopedic surgery. Overall, 51.6% of patients were female, and the mean age was 70.9 years old. At hospital admission, 531 patients were classified as ASA Class 2. In the study period, 16 or 30.0% of patients had documented positive KUB and or POI at UCSF Medical Center. The median time to ambulation for patients who developed POI was 19 hours compared to 18.5 hours for patients without POI. The median length of stay for patients who developed POI was 7.2 days compared to 2.2 days for patients without POI, which was statistically significant. The median OMEs administered was 60 in patients who had positive KUB and 29.3 in patients who did not have positive KUB.
As you can see, the prevalence of POI in surgical patients greater than or equal to 65 years at UCSF Medical Center was low. While not statistically significant, the median OME in patients who developed POI was more than double the amount in patients who did not develop POI. Hospital length of stay was significantly longer in patients who developed POI compared to patients who did not develop POI. Prolonged length of stay can potentially lead to increased hospital costs, hospital-acquired infections, and other adverse outcomes. Age, administered OMEs, and hours to ambulation were positively correlated with incidence of POI, whereas oral naloxone administration and patient-reported pain scores were negatively correlated with POI. Both time to ambulation and OMEs administered during inpatient stay were not found to be statistically significant predictors of development of POI. We believe this study can be used to further guide research regarding incidence of POI using larger sample sizes and among different medical centers. In addition, we hope this may guide postoperative opioid prescribing practices, as well as pre- and postoperative bowel regimen prescribing practices among surgical patients in the prevention of POI.